Over the past year, thousands of Guyanese received the Russian-made Sputnik V vaccine as part of efforts to protect themselves from the deadly coronavirus. But now, with its approval from the World Health Organization (WHO) still pending, Minister of Health Dr. Frank Anthony says that the local authorities are administering fewer amounts of this vaccine. He spoke at the sidelines of an event on Monday.
Most people, when they come, they either want to get a Pfizer or a J&J, and so we've been administering that.
How many perhaps doses of Sputnik V vaccines do you have that are unused?
I don't have the number right now.
Okay, is it?
But basically, we have a second dose for those persons that would have received a first dose. So we were keeping it to make sure that we cover those persons who need the second dose.
Though the health authorities have been keeping those second-dose vaccines for those who received the first Sputnik V dose, Dr. Anthony lamented that more than 80,000 people generally have not returned for their second COVID-19 dose. A concern that has been raised by people is that they are getting different sets of vaccines altogether to bypass challenges of vaccine acceptance because of Sputnik V's pending approval status. Dr. Anthony, however, noted that this challenge is one which the local health authorities cannot readily target.
Well, it's hard to say, right? But what we have been trying to do is to make sure that people come and get their first, second, and booster doses. And it varies by vaccine, the time interval. Now, some people, because several months ago, the vaccine that we had was Sputnik, and for going into some countries, they're not accepting Sputnik, so people have wanted to get revaccinated, but by now I think a lot of people, rather than being revaccinated, they might have come and gotten their booster shot. So if you have 2 doses of Sputnik and you use the J&J as a booster shot, you would be allowed to travel.
He could not provide the breakdown of people who need to get their second dose of the Sputnik V vaccine, nor could he say how many first and second Sputnik V vaccines have not yet been used. Reporting for the newsroom, I am Vishani Raghavir.